Hi, everyone. This is Desiree Castillo with Centralized Training at UT Health San Antonio. We are happy that you could all join the webinar today. I'd like to welcome back Dr. Susana Rivera, who's going to be presenting on TF-CBT and behavioral problems. Just a few reminders. Remember, everyone will be muted throughout the course of the webinar. But feel free to use the questions box for any questions or comments that you might have. Remember also to choose either your speakers on your computer or your telephone to prevent any feedback. The slides for today are available in the handout section. And of course, we are recording the webinar, so both the link as well as the slides will be emailed out to all who have registered later on this afternoon. Again, thank you for joining us, and please welcome Susie Rivera.
Thank you, Desiree. And I have to say, I am really, really happy to be back. Our first two webinars seem to have been really well received, and I've been looking forward to this one. And for all of you that are listening, I just have to say, before we connected live, I was telling Desiree I've been stressing about today's webinar because I was on call for federal jury duty, and there was a possibility that I would have to report today, and I was just praying, please, 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 no jury duty on Tuesday, because I do not want to have to bail on this webinar. And my prayers were answered. I called in yesterday, did not have to report today, so I am here, and I am just so happy to be able to do this today. There is the option, as Desiree said, for you all to send in questions. I will be keeping an eye on that, and so will Desiree. So if any questions do come up, I will answer them as we go along. I know that in some instances, people prefer to send their questions in afterwards. If you do submit a question to Desiree, rest assured that she will forward it to me, and I will send an individual reply to whoever sent their questions in. So we have quite a bit to cover this morning, so we will go ahead and get started. And I know that this is a topic that people seem to really, really be interested in, is how do you do TF-CBT especially when the biggest concern seems to be behavioral issues and not so much the effects of the trauma itself. And I am trying to switch my slide, and now for some reason it will not move forward. Okay, we did not have this issue on the first couple of webinars. I am not sure what is going on today, so just give me 1 second. And okay. All right, and we are back to normal. I'm sorry about that. I should have checked on that before we started. So as I said just a minute ago, most trauma-exposed children are going to present for care seeking treatment for behavioral issues, not necessarily for PTSD symptoms. At least that has been my experience at the site that I'm at, and it seems to be the same for almost everybody that I have done trainings with and that I have done consult calls with. Yes, there is trauma exposure, and yes, parents are concerned that the behaviors are related to trauma, but that also brings up other issues. And I have found that we have to do quite a bit of child development work with caregivers, because we have to explain to caregivers sometimes that not every undesirable behavior is necessarily trauma related. Sometimes it is just the kid being a typical 8-year-old. It is just the kid being a typical adolescent. And so we don't want every behavior to automatically be attributed to, well, it's because the child has been traumatized, because that easily becomes a crutch for children sometimes. I've seen this actually with a lot of adolescents where I'm certainly please not trying to, diss adolescents or anything, but I've seen it sometimes where the adolescents will say, well, it's because I can't help it. I behaved like that because I was traumatized. And I'm thinking, no, darling, we need to talk about this. Sometimes they're just being a little rebellious, trying to push their limits. But I also see this with the parent sometimes, and this is why the parent component is so critical, because I will see sometimes where the parents will become very, very lenient with kids, not wanting to set any kind of rules or boundaries, not wanting to establish any kind of consequences, because even though the child is misbehaving, they're acting out. What I hear sometimes from parents is, well, my poor child, they've been through so much already, so I'm trying not to be really harsh on them. And so that, of course, is just going to lead to, all sorts of other behavioral issues. So we we want to make sure that we are striking a good balance so that we are addressing the behavioral issues but still remaining faithful and maintaining fidelity to the TFCBT model, which of course does address behavioral issues, but sometimes we have to look at what is it that is really the priority right now? So, am I going to focus on the trauma symptoms and address the behavioral issues, or are the externalizing behavioral problems so severe that I really have to stabilize the behaviors first before I can move into any trauma focused work? And you will often see externalizing behaviors like oppositional behavior, noncompliance. Some children become very physically aggressive or destructive. And of course, we also see some of the riskier behaviors, some of the self injurious behaviors. So, during the assessment process, we really want to identify the trauma impact. And one thing that I always want to look at is the onset of the behavioral issues. And that's what really helps me to narrow my focus, because I want to know if these problematic behaviors, whatever behaviors the parents are concerned about, if they started, if the onset of them was correlated somehow to the trauma exposure. And sometimes the behavior was there prior to the trauma occurring, but after the trauma occurred, then the behavior became exacerbated. So this is where I know, okay, the behavior is actually related to the traumatic event, but then I also need to see the extent of the behavioral issue and the severity of it. Because you will see that in some cases, the behavior is pretty significant. You're having the child that is becoming very destructive, very disruptive. They're not able to sit in school. They are engaging in maybe fights at school. They are vandalizing things at school. So you have the child that is constantly being suspended, being sent home. Maybe they're expelled. They're sent to an alternative school. You might see some of those behaviors at home also, but sometimes the behavior is just more of, and I don't want to minimize, but sometimes the behavior is they're not following the rules. They don't listen. They don't want to get up and go to school. They don't want to do their homework. They keep breaking curfew. So yes, of course, those are issues that we want to address with parents, but that is not something as severe. So that is something that I would definitely address as I go through TFCBT. But we always, just regardless, we want to address behavior problems. That has to be one of the focuses of treatment, because this is what's going to motivate our families to engage in treatment. Because remember, I am known for doing trauma work in my community. For those of you that are not familiar with me or are not familiar with where I'm from, I'm in Laredo, right on the Texas-Mexico border, and I'm assuming that most of you are from Texas. So if you remember your geography, I'm right smack on the border. And just, this whole surrounding area, I've kind of become known as a trauma expert. But despite that reputation that I've kind of built up over the years, most of my referrals are for behavioral problems. I get the calls from parents. I actually just got a call from a father about an hour ago, and he wants me to see his child because of behavioral problems. And I, just do a quick little screening over the phone, and there's an extensive trauma history. But dad kind of downplayed that and just really focused on his behavior is out of control. So this is why they're going to come in. So I have to address those behavioral problems because this is what's going to keep the families coming back. And also because these behavioral issues are likely to continue or to escalate if they're not addressed and if they're not effectively managed. So this is where the parenting component is so important. And of course, we do address behavioral issues with the children, especially when we're doing the C component of TFCBT. If you think back to your face-to-face training, your online training, we have the practice components. And the C is the cognitive coping. And this is where we start introducing that relationship between thoughts and feelings and behaviors. And I have found that when I'm introducing that cognitive triangle, I actually have better luck when working with kids if I start with the behavior point. So, what are the behaviors that are getting them into trouble, that are getting them punished? The behaviors that maybe got them referred to treatment, the reason that they are on probation, maybe. And so, if I start with the behavior and what it is that they're doing and how they may be acting out, and then work backwards to their thoughts and their feelings, I actually have much greater luck than if I try to start with the distorted thoughts and then tie that into how they're feeling and how they've been behaving. So, certainly during the A and the C components, we're definitely going to address behavioral issues with kids. But this is something that we're also going to address just really, really strongly during the parenting component. So, in order for TFCBT to be effective with trauma exposed children that are presenting with behavioral problems, the parenting component especially is going to require a lot of focus. And I realize that sometimes this becomes an issue because if you've been on consultation calls with me, you know that we often spend time talking about caregiver engagement because sometimes it is just so difficult to engage caregivers for different reasons. They may have their own trauma history, and so doing this kind of treatment may be very triggering for them. You have parents that are just not supportive, or they're just so overwhelmed with so many other things that are happening in their lives that it's difficult for them to really focus on treatment. And of course, you have your parents that maybe prefer to adhere to a more traditional approach to therapy, which is they come in, here's my kid, fix them. I'll be in the lobby, playing on my smartphone. You tell me when you're done, and I'll take my kid home. And so there's not much interaction between the caregiver and us. And a lot of parents actually prefer that. So we really, really want to emphasize the importance of the parenting component and having the parents be consistent with not only attending the sessions, but also be consistent with implementing the techniques and the strategies that we introduce, because that consistency and that follow through at home is what is going to help for them to see some improvement in the behavioral category. And one thing that I want to mention now so that I don't forget to mention it is I have to stress repeatedly sometimes just the importance of acknowledging those small little successes, those little baby steps, because I will hear from the parents that the parent is getting calls from the school every single day. And so I start working with them, and hopefully the parents are following through. And then I see them a few weeks later, and I want to just do a check in, and they say, well, I'm still getting calls from the school. And so I try to focus on, okay, when you started coming in, you were getting a call every single day: Monday, Tuesday, Wednesday, Thursday, Friday. How about now? Are you still getting calls every single day? And I often hear, well, no, I'm not getting calls every day, but I'm still getting calls. Well, yeah, because TFCBT is effective, and I think I'm quite skilled, but the model is not, perfect, and I'm not a miracle worker, and I cannot make all of these behavioral issues. I can't make all of these trauma symptoms disappear from one session to the next. So we want to celebrate those little successes. So if you used to get calls 5 days out of the week and now you're only getting called 4 days out of the week, that is progress. And we're going to praise that. And we're going to celebrate that. And we're going to work on cutting it down to only 3 calls out of the week. And then we'll cut it down to 2 calls out of the week. So we want to just emphasize with parents to celebrate all of those little baby steps. So while we're doing the parenting component, of course we're talking about standard behavioral management skills, um, but also just looking at it within the context of trauma focused therapy. So we want to increase their positive encounters. And I'm always, always, always stressing praise and catching your kids being good. And so one of the questions that I often get from parents is, why do I have to praise my child for doing what they're supposed to be doing anyway? So I used to really struggle with that. And I finally started getting greater success and getting greater follow through when I reframed that for parents. So the way that I phrase it now is, you're not so much praising your child as pointing out what they did. So if they have a chore that they are supposed to do, and you point out that they did their chore, to me that's praise. The chore is, you have to take the trash out after dinner. And so if I tell the parents, praise them, hey, great job taking the trash out, you know thank you for helping me by taking the trash out. If I take away the word praise and I say, you're pointing out that, oh, you took the trash out today, what you're doing is you're pointing out what they did, and you're reinforcing the probability that they are going to continue to do it. And the more that they continue to do it, then that's increased respect for you as the caregiver. That's more respect for you and your role as a parent. So when I reframed it that way, I started seeing that parents were a little more open to that. But I also make it a point to praise kids in front of their parents. And I always try to find something to praise in the parents as well, because I want the parents to see that I am noticing something that they are doing, something really positive, and I want them to see just how good it feels when someone points out that you did a good job. So I will, this week, for example, it is, it is forecast to be up to 110 this week in Laredo. And so I understand nobody wants to go out. I also understand it's summer and everybody just wants a break from everything. So I'm going to praise my parents this week. Hey, nobody wants to be out in this heat, but yet here you are bringing your child to therapy. This just shows me what a committed parent you are. Thank you so much for coming in today. Or, hey, I know it's summertime and wow, you've got a break from the routine every day, and I'm sure you'd like a break from counseling, but I'm so happy that you're here. This just shows me, what a strong parent you are. You're still making the effort to come in and bring your child in every week. So I'm just so thankful that you're doing that. So I will throw comments like that out um, because this is how I'm modeling for parents for them to reinforce positive behavior in their children and ignore those minor irritating things. I know that having your child roll your eyes at you or mimic, what you're saying, I know that is disrespectful. But when you have a behavior like that and you have a child who is, really destructive, engaging in risky behaviors, it comes down to picking your battles. And so I make it okay for parents to ignore those, eye rolls and the mimicking and the sighs and all those little annoying things that kids do to kind of get on our nerves. And I do validate that yes, those behaviors obviously can be very challenging, and you don't really want to overlook them because yes, it's disrespectful, and we don't want to encourage that kind of behavior. But I do try to focus on, are they hurting themselves? Are they hurting anybody? If they're not, can we overlook that? And let's focus on the more challenging behaviors. And this is also what's going to help later on when we build that functional behavioral analysis, which we'll get to in just a few slides. But this is also going to start getting parents to start monitoring behaviors and start developing those behavior management plans. So through the parent component, we are going to work on that reinforcing the positive behavior, ignoring some of the irritating minor behaviors. We're also going to work on increasing those positive interactions that parents are having with their caregivers. We're going to increase communication and problem solving, but those are skills that are going to require a lot of practice between sessions, which is why we really want to emphasize the importance of just staying engaged with the caregiver sessions and practicing the skills in between. Of course, before we can even think of doing TFCBT, I'm just kind of going back to our training here. We do want to determine whether trauma-focused treatment is indicating, was there actually exposures to some type of trauma, and are there trauma symptoms present besides the behavioral issues? I do realize that sometimes we are concerned about bringing up trauma exposure very, very early on in treatment. And I always do stress that we want to go at a pace that the child can tolerate. We don't want to overwhelm the children with the exposure, and especially when we have children who are self-injuring or engaging in some kind of risky behaviors, for example, substance abuse. Because if we overdo the gradual exposure, then and we haven't had an opportunity yet to introduce those stress management techniques and the coping skills, then we run the risk of they leave the office and they cope by engaging in a risky behavior. So this is where a lot of the concern comes from about bringing up the trauma exposure early on in treatment. But the research and the evidence is showing us that asking children about trauma exposure typically results in pretty positive outcomes, actually. So children are ordinarily not going to spontaneously identify these experiences. So we really have to be the ones to ask about it. So I almost feel like right now I'm kind of giving you permission to ask about trauma exposure. So don't back away from that. Even if the parents are saying, no, it's not about the trauma, they're doing okay with that. The problem is the behavior. Yeah, the problem is the behavior, but if it is somehow related to trauma exposure, and if I'm going to do TFCBT and I'm going to do it well, then I need to address this. So, again, we want to evaluate whether the symptoms are related to trauma exposure or not, and that's not just behavioral, but any PTSD symptoms, depression, anxiety, anything at all. Again, it goes back to, can you correlate the onset of symptoms to the trauma exposure? If they do not have any trauma symptoms, and this is entirely possible. Not every child who experiences a traumatic event is going to automatically experience trauma symptoms. Some children are very, very resilient. Some children are just not that affected by it. So if you do have a referral, and yes, there is obviously trauma exposure, but there are no PTSD symptoms, there's no avoidance, no self-blame, no maladaptive coping strategies, no attachment issues, then trauma-focused treatment is likely not going to be appropriate. We would, of course, still do treatment, but we would look for a different model that would focus solely or specifically on the behavioral problems. For young children, I will tell you one of the models that I tend to use a lot is PCIT, parent child interaction therapy. And for a lot of my children, I will start, and this is with children under the age of 8, I will start with PCIT first to regulate those behaviors. And then once they have completed PCIT, then I move into doing TFCBT with them. Yes, it does extend the course of treatment, but it also makes it easier for me to do TFCBT because I've regulated those behaviors that are so severe that they're interfering or they're making it difficult to do the trauma work. Children are most likely the most accurate reporters of their internalizing symptoms, but we do want to assess for behavioral issues by gathering information not only from parents, but do you have access to any other caregivers? I think if you can get consent, my goodness, I want to talk to anybody and everybody that I can. I want to talk to teachers. I want to talk to school counselors. I want to talk to the principal if they keep getting sent to the principal's office. I want to talk to CPS caseworkers. I want to talk to probation officers and judges and anybody else. I want to talk to babysitters. I want to talk to, the aunt that spends a lot of time with the child. All of that information that you get from them is just going to be so critical in establishing patterns of behavior, because that's going to help me also to figure out triggers. What is triggering these behavioral issues? And again, if the behavioral problems are so significant, so severe, that we know we're not going to be able to focus on trauma issues until the behavioral problems are resolved, then let's do that. We'll put the trauma work aside until the behaviors have been stabilized. And sometimes the behaviors that we need to stabilize are things like substance use, are things like eating disorders, things like self-injury. So of course we need to stabilize that before we get into the deeper trauma work. Now, assuming that the child, and actually let me pause for a second, I am keeping an eye, and I have not had any questions come up yet, so I just want you all to know that I am watching for that. So if you do have a question, please feel free to send it, or if you prefer to hold it and have me answer it privately later, that is fine as well. But I just wanted to acknowledge that I am watching the question box at the same time that I'm watching the slides and watching the time. So, assuming that there are both trauma symptoms and behavioral problems, but the behavioral issues are not overwhelming, then we can proceed with doing TFCBT, but we do want to conduct a functional behavioral analysis of the behaviors. And this is something that we will do, of course, with the caregiver. And we want to stress to parents that behaviors have a purpose. And the purpose is to achieve a goal, whether it be getting attention, getting extra privileges because we did something good, or avoiding a negative consequence. So I'm going to behave in a certain way to either get a reward or to avoid getting a punishment, avoid losing a privilege. And I always remind caregivers also that bad attention is better than no attention. So some children will behave, I hate to use the word misbehave, but will behave and engage in undesirable behaviors because, yes, they're going to get scolded, they're going to get reprimanded, they're going to get punished. But the point is, they're getting attention from their caregiver, and that's what they really want. And that's the only way they know to get it. And this goes back to, do we ever catch our kids being good? Because if I give my child attention for not fighting with a sibling, for um, helping me to clean their bedroom without being asked. If I give them positive attention for getting a good report card, then the likelihood of those behaviors continuing increases. So I do focus on attention and catching your kids being good. And the basic principle of doing a functional behavioral analysis, and you'll see an example of it in just a couple of minutes, is that behavior is rewarded. Positive behavior has to be rewarded. They're going to gain something good. They're also going to avoid something bad. And we want that to persist. But we also need to, it's not just about setting rules and consequences for doing something bad, but it's also having consequences for something positive that they did. And we also want to remind caregivers that a lot of the trauma related behaviors that are problematic often involve avoidance of memories and reminders that produce distress. Right now, I'm working with a child who recently lost his grandmother. This is somebody that he was very, very, very close to. And it's been very difficult for him to deal with that loss. And mom needs to go to grandma's house and they need to start cleaning out the house and they're going to put the house on the market and there's stuff that needs to be done. And she wants her child to help her and he will not help her. And she is so upset because he knows that she needs help. He knows that this is a lot of work and he's not willing to help her. And I'm trying to focus on every time he goes to grandma's house, it's a reminder for him. It's a loss reminder. And I understand that mom is grieving too. Well, mom is coping with her grief by just, occupying herself with all the things that need to be done. And he's taking a more avoidant approach, and there's nothing wrong with that. So we want to remind parents of that as well. So, in order to conduct a functional behavioral analysis, and again, you all do have access to these handouts, so you do have this. We want to look at several things, and these are things that we need to evaluate with a caregiver. What is a pattern? What settings do these behaviors occur in? What is the context for it? This goes back to identifying triggers. How severe are the behavior problems? And I know that severity can be very subjective. So this is something that I'm going to work on with parents. Is it really something severe? Is the child at risk? Or is it more of, it's not that severe, but it's annoying to me and I just want them to stop? What are the antecedents? What are the triggers? Are there any consequences that are being implemented to respond to these behaviors? And if there are consequences, are they implemented with consistency? Because kids know that, yeah, my mom says I'm going to get it. She doesn't do anything about it. And I'm sure that y'all have seen this at the grocery store, that you're in line and the child is acting up because they want a toy, they want a candy, they want something. They're getting fussy, and the parent is saying, "You just wait until we get home." And I'm standing there and I'm thinking to myself, are you really going to follow through when you get home? Is there really going to be a consequence for it? So that consistency is really important. And if there are consequences, what is the child's response to it? Does it exacerbate the behavior? Are you just making things worse? Does the child respond to the consequence? Has this behavior ever been addressed in treatment before? Again, and I've reiterated this several times in the second to last bullet on this slide, the relationship between the behavioral problems and the trauma. Did the problems begin after the trauma experiences? Did they predate the trauma? Or did the nature or severity of the behaviors change noticeably after the trauma occurred? So these are things that I need to be aware of before we even get into starting to manage the behaviors. So we want to establish the extent to which the behavioral problems are trauma related, and we want to do this before we initiate TFCBT. Sometimes it is difficult to make that connection, and that's especially because for some children, there's no such thing as life before trauma. So, have these behaviors been present all along? Yes, but the trauma has also been present all along. So, these are times that we're going to have to work a little bit more closely with parents to determine what is it that is setting these behaviors off. And of course, it's really critical for us to explain what TFCBT means, what it is all about. So specifically that during each session, we're going to address the behavioral problems. Absolutely. And that's going to go a long way towards engagement. But we're also going to be addressing trauma issues. I know that the main concern for the caregiver is the behavioral problems, but if it is tied to trauma exposure, there's not a lot that I can do about the behavior unless I address the underlying trauma that is leading to these behaviors. So we want to have a good balance between addressing trauma issues and behavioral problems as well. So I've mentioned this already, and I'm keeping an eye on the time. I'm going to be respectful of everyone's time, and we will be done by 12. So I know we're covering quite a bit, and I'm sorry if I'm going a little bit rapidly, but there's a lot that I want to cover. You do have the handouts. You do have access to them. And afterwards, I'm happy to address any questions that might come if you feel that I didn't cover something in the depth that you were hoping for. We have talked about motivation and engagement already this morning. And what we want to do, our goal is to establish a foundation for a collaborative working relationship between ourselves and the parents so that the parents are engaged in this process. So when behavioral problems are their primary concern, the initial focus of treatment is going to need to be to address the behavioral problems, but while at the same time helping parents to see the link to the trauma so that it makes sense to them why we are so focused on the traumatic event and resolving that. So in order for us to see a successful behavioral change, there has to be motivation. But there also has to be engagement. So just having them constantly checking in with us. And I mentioned the checking in because when I do a functional behavior analysis with caregivers, I have to make it a point to just take 5 or 10 minutes out of my day and check in with parents every day between sessions. Just, hey, how did it go last night? Hey, how did it go yesterday? Any calls from the school? Okay, are you implementing our plan? And just really encouraging parents to do that. Because if the families are not consistent, if they're not engaged, if they only come in sporadically, Or I'm sure you all have heard the parents who are listening to you, and when give them some strategies, they immediately say, "No, I've tried that, it didn't work," or "That won't work with my kid," or "My kid is different." If we're getting that, then therapy is not likely to make that much of a difference. I can only do so much with the child in regards to behavior. I need the caregiver to also do their part. That's going to be really, really critical. And the way that I often describe this to parents is it's like going to a doctor when you're sick, and the doctor says, "Well, you have this illness, you have this infection, you have this condition." The condition is going to improve, and your symptoms are going to start to disappear, but you need to take this medication, and I need you to take it, 3 times a day, every day. If you don't take your medication because, I don't like taking pills, uh, that syrup doesn't taste good. The doctor doesn't know what he's talking about. If I don't take that medication consistently, I'm not going to feel better. And I might even get sicker. So I'm going to go and I'm going to be upset with my doctor because, hey, I went to him for help and I still feel crappy. Well, I didn't take the medication. I didn't do what the doctor said I had to do. So, same concept with therapy. So, behavior problems, a child's behavior problems will respond to training parents in behavioral skill interventions. And of course, teaching older youth TFCBT skills. This is where we're going to start to see that difference. When children's behavior does not improve, it is typically because the interventions are not being implemented consistently or they're not being implemented correctly. And again, I can only do so much in session, but I'm not with the child every day. So it's not solely up to me to change the child's behaviors. I can help the child to understand where his behaviors are coming from and for him to realize that it's because of his distorted thoughts, it's because of all of that negative emotion, it's because of avoidance, but I alone cannot change those behaviors. So you have a sample behavior management plan, and this might look familiar. I do include this in my trainings, but I just thought it was worth repeating. So the sample behavior management plan, this is what we want to do with the parents. So let's focus on one behavior at a time. I cannot magically fix every behavior all at once, so let's focus on one. In this example, I have fighting with siblings. So in the beginning, I know it's difficult. Let's just monitor the behavior. Without intervening in any way, let's just monitor it and let's just determine what is setting it off, how often is it happening, when is it happening, what triggers it. I also want to know, and I didn't include it here, but how does a parent typically respond to that? And then let's come up with a plan. So, how are we going to respond to the hitting? And again, you'll see in bullet number 3, there are not only consequences for hitting, but there are also consequences for the child when he interacts without hitting, without violence. So, is a child getting praised for it? Is a child getting some kind of acknowledgement that, hey, he is interacting with a sibling without fighting? So what are the consequences going to be if the child does engage in the undesirable behavior? So are they going to get time out? Are they going to lose a privilege? Are they going to not get to go on an outing? What is consequence going to be? And then we have to follow through. And the parent, again, we really need to stress consistency. Um, so they try it for a week between sessions, and then we follow up with them. And if you can, if you have that flexibility, please try to follow up every day. But follow up. How well did the plan work? If it's working, that's great. Praise the success. If it's not working, all right, let's modify it. So maybe the consequence wasn't very effective. How do we change it? What can we do differently? And make sure that it's not only the negative consequence, but the positive one as well. So if we have to modify it, put a new plan into place, and let's monitor the behavior again for another week. And as you achieve, as a caregiver, achieve success with a behavior, then we start looking at other behaviors. And this is how we're going to start to see that progress with children. Now, one thing that does sometimes contribute to a lot of these behavioral problems is what we refer to as the COW, or the crisis of the week. And these are very common in children with behavioral problems. And this is usually going to take the form of some kind of disruptive behavior that the caregiver continues to struggle with, that they're upset about, that they don't believe has been resolved. So this is something that they're going to continue to bring to session as a pressing concern for them. And I try to stress with caregivers that this is usually, an indicator of ineffectively managed behavioral, issues, or some maladaptive functioning. Now we have to be really tactful about how we do this because, it's difficult sometimes to address parenting without sounding as if we're calling the parent a bad parent. So we want to talk about, okay, how are you managing these behaviors? Let's look at a more effective way of managing the behavior. But we also want to acknowledge that sometimes it's about traumatic avoidance, and this is where those behavioral issues are coming from. This is where the COW is coming from. Now, we do want to differentiate, though, between a boss and a COW. A boss is a barrier or an obstacle to safety and stability, and that takes precedence over anything because the child's safety is at risk. The crisis of the week, that's more of, that can be the child bringing in a COW because, again, it goes back to avoidance. And I swear that sometimes I think the kids sit at school or in the car on their way to therapy, and they're thinking, what can I talk about so that I don't have to talk about trauma today? So I sometimes think that, it's like, well, I need to talk about this fight I had with my best friend today. Because if we focus on that, then we're not focusing on the trauma and the reason that they're really here. And the same can be said for the parents. And so we really need to redirect the session. What we used to do in the beginning when we first started doing TFCBT, and we now know that was not very effective, is that we would set time aside to deal with a COW. So yes, I understand, there's this issue, but we really need to focus on today's session. But at the end, we'll leave, a few minutes and we'll talk about this behavioral issue. We'll talk about whatever's going on with the child. And we just would not let it derail treatment in any way. But we found that was not effective. So what we're doing now, the way that we're managing the COWs, the way that we're managing the crisis of the week, is by working with the child and working with the caregiver to conceptualize how it is actually a trauma manifestation, and also how the TFCBT components that we've been learning can help with this COW. So it's going to be critical for us to maintain the focus of therapy while skillfully addressing the COW. Because if our attention is constantly being diverted from the trauma work to what the COW is, then we're feeding the child's avoidance, and we're also not going to successfully resolve whatever the trauma impact is. So we want to be aware of this dynamic and not let the COW deter from us spending the time that we need to on the actual trauma, which is the reason that we're doing TFCBT. So we might also have to do a functional behavioral analysis of the COW to determine why it's happening, what's reinforcing it, and then coming to a conclusion about how we're going to handle it. So I have a couple of examples. This is a child's COW. So you have a teenager who comes to session very distressed. This teenager learned that her friend is spreading rumors about her and is trying to steal her boyfriend away. And I'm sure that for a lot of you, this is a typical session. A teenage girl may want to focus on this rather than doing the trauma work. So we don't want to dismiss this because this is, a real issue for her. But we also don't want to just focus today on, well, yeah, your friend is not really a friend. And then, we're going to talk about the boyfriend and the best friend, and we never get to the trauma work. So a better response, and you see a little sample script here. I'm sorry to hear that. It must be aggravating. So how should we handle this today? We can talk about it for a few minutes and then get back to our plan for the day. Or we can use this situation to see if there's any way that you can apply what we've been learning. So, for example, how did you handle your feelings about it? How could you use a cognitive triangle to make sense of your reaction and maybe find ways to think about it differently? So, what would you like to do? And I've actually done this with a lot of kids where, okay, so we're not really talking about the trauma, but because I bring my cognitive triangle into this, yes, I spent the session talking about the boyfriend and the best friend, but I'm reinforcing one of the components. So I'm reinforcing thoughts, feelings, behaviors. So, what are your thoughts about it? How is it impacting how you feel? And how is that impacting the way you're behaving towards your friend and towards your boyfriend? And so then I am able to easily segue back into the trauma work. So, did we address the cow? Yes. Was it trauma related? No. Did I do trauma work? Well, I still did do one of my TFCBT components. So, maybe I just introduced the cognitive triangle, or maybe it was a good review of it. In the next example, I have a parent cow. So, now you have a parent who comes in angry and frustrated because of an incident that happened at school. The child got into a fight with some classmates, was disrespectful to the teacher, and now there's a possibility that the child might be expelled. This is a very genuine concern for a caregiver. I mean, definitely. And this ties back to the behavioral problems. So, of course, the parent needs to address behavioral issues because this is what is causing the problems at school. So, a good response? Yes, I understand how that can be upsetting. You're trying to keep everything going, and if he gets expelled, then that's going to be a hassle because you're going to have to take time off from work to find a new school. You might get into trouble at work for taking time off. So, how can I help you resolve this? So, could we do a functional behavioral analysis, and can we come up with a plan? And if that's not something that they're interested in doing, then we can get back on track with what we were working on related to the trauma impact. So, am I addressing the behavioral issue? Yes, I'm trying to address the child got into a fight. I want to know where the fight originated, what caused it, what triggered it. Was the child being triggered by a trauma reminder, and this is why the child reacted the way he did? So this is something I can work on, but I also still have to do my trauma work. But hey, if I can do a functional behavioral analysis, then I can give the parent something tangible so that they're able to go home and address this issue of possible expulsion. But at the same time, I'm reinforcing the skills that I've been trying to teach them, but also not letting this derail me from my trauma focus very much. So, excuse me, what does all of this mean? When you have a family of a trauma exposed youth that is presenting with behavioral problems or complex situations, more than likely their priority is going to be on the behavioral issues. It is up to us then to use our clinical judgment and decide whether the behavioral problems can be effectively addressed by TFCBT, or whether we need to triage for priority. Are the behavioral problems so severe that they need immediate attention? Is the behavior problem so severe but not trauma related that we want to shift our focus then? And even though there is a trauma history, there are trauma symptoms, that is not the primary focus right now because the child seems to be coping well with the trauma and the behavioral problems are not in any way related to the trauma exposure. So then we will implement a behavioral focused intervention instead. And then once the behavior has been stabilized, then we reevaluate. And if there are trauma symptoms that need to be addressed and TFCBT is indicated, then we go back to TFCBT. So this goes back to not every child that has been trauma exposed needs trauma focused treatment. Once we do identify that behavioral problems are going to be the treatment target within TFCBT, then we want to adhere to the basic principles for addressing these problems. So these are your typical behavioral problems that arise in childhood and in adolescence, and maybe they are being triggered by trauma reminders, and so the child is acting out. But we just tie this back to the TFCBT components. And this is how we address it with the children, and this is how we address it with the caregivers, and this is how we're going to address cows. And finally, even if the behavioral problem is a primary target of treatment, TFCBT is not what is being provided unless there is a consistent and regular trauma focus during every session. And I know that I've always said one of the reasons that I really like TFCBT is because it is not rigid and it allows me to go where the child needs to go at a pace that the child needs me to go. And so TFCBT does allow for flexibility. It allows me to spend more or less time on a component depending on what the child needs. It allows me to take the components out of order depending on what the child needs. But even though we are able to be flexible, we still need to maintain fidelity to the TFCBT model. And if we are focused solely on behavioral issues and we're not focusing to some degree on the trauma exposure and the trauma symptoms at every session, then we're not doing TFCBT, and then we need to reevaluate whether TFCBT is the appropriate model and whether we need to do a behavioral intervention instead of or before we can do TFCBT. And that brought us right up to 2 minutes before our time. I'm looking again at the question box, and I see no questions at all. Desiree, I'm assuming that you can see the same thing that I can. If anybody does have a question that they would like to pose, you can send it to Desiree and she will forward it to me. On this final slide on your screen, you also see my email, so you are welcome to direct your questions directly to me and I will be happy to answer them for you. Desiree, that's all I have. I'm sure you have some closing words. My final comment is just, I would like to thank everybody for spending a part of your time with me this morning, and thank you for implementing TFCBT and just working so hard on behalf of all traumatized youth. Desiree?
Thank you, Dr. Rivera. Correct. I don't have any other questions or comments that I see on my chat box or my questions box, but if you do think of something later, feel free to email me or Dr. Rivera. As mentioned at the start of the webinar, we did record it. We do have the slides. So anyone who might have missed it but did register will be receiving the email a little later this afternoon with all of that information and can access the webinar at their convenience. So thank you again, Dr. Rivera. That's all I have. So just looks like we wrapped up just in time.
Yes, thank you very much, everyone. Have a good rest of your day. And thank you, Desiree, for coordinating.
Absolutely. Goodbye.
Goodbye, everyone.